It is time for the Slocum Dickson Medical Moment. We do it once a month. We partner with our friends at Slocum Dickson Medical Group over on Burstone Road. You can check them out online, sdmg.com. Slocum Dickson Medical Group, sdmg.com. You can like their Facebook page. And their number is 798-1500. In studio right now, orthopedic joint surgeon, Dr. John Sullivan. Dr. Sullivan, good morning. How are you?
Good morning to you guys.
Thank you very much for coming in and joining us and whatnot. I always find this kind of stuff interesting because, like, you're the joint person, so you're doing, shoulders and elbow, head, shoulders, knees and toes, But seriously, you're doing like the knee replacements and like partial replacements, and when they get to you, there's some serious pain going on, and it's all about making things better and giving people a new start.
Oh, definitely. I mean, I think joint replacement surgery, I don't think there's a surgery that's greater than improving somebody's quality of life. I mean, you have somebody who's barely able to walk or just can't do the things that they want to do or enjoy anymore, and this gives them a new leaf on life, definitely a new leaf on life. So I think it's something that nobody ever wants to go through.
Right.
But if you're the person who needs it, I mean, it's great.
Now, and I know that Slocum has a lot of new stuff as far as how you do the actual replacements and whatnot. My question for you is, what kind of things get people to that point? Because obviously no one wants to have the knee replacement. No one wants to have a joint replacement because it's again, it is one of the most beneficial, but it's also very extreme. What are the main things that kind of get people to that point, with the knees deteriorating or the I've heard a lot of people with hips deteriorating as well. Are there certain things that really kind of grind on that? Is it weight? Is it like
weight? Definitely is a contributing factor. But there's also a lot of genetics that comes into play. So obviously there's a lot of people who are,
Thanks, Mom and Dad. Sorry, go ahead.
But, sports injury is certainly a contributing factor. I think kids nowadays tend to do a lot more sports than they did years ago. So I think we're injuring ourselves at younger ages than we used to as well. So I think we find that, and also we've gotten a lot better at doing the things that we do. So people are thinking about doing it at a younger age, where before people were, completely devastated before they would think about doing this. Now they see their friends, they're like, wow, they just had their joint replaced and they're getting it wrong pretty well. Why should I suffer when I see them doing so well after they had their surgery? So I think people are starting to think about it a little bit earlier than they might have in the past.
Absolutely. It's a Slocum Dickson Medical Moment here on KISS FM. We have Dr. John Sullivan, orthopedic joint surgeon, in studio. Like the Facebook page, Slocum Dickson Medical Group. You can type it right in and like the page there as well. The old wives' tale was, once you got your joint replaced, it really, I don't want to say it was a death sentence, but it seemed like it was the end. You know what I'm saying? Like, you wouldn't be able to do the fun stuff that you used to do once you had that done. But that's totally not the case anymore. But that was the old school thinking, but that's not the case anymore, right?
No. I mean, the reason to do it is to keep going. I mean,
exactly.
That's the number one reason to do, is keep your lifestyle up. And I mean, there's some things that we tell you not to do, like no running and jumping. But let's face it, most people who are getting the surgery aren't doing running and jumping in the first place. So you're not losing anything.
So talk to me about, because all I hear about is there's robotic arms involved with the replacement. Well, talk to me about this, because this is something that not everyone, number one, knows about, and something that's definitely very, very cool that's going on at Slocum.
One of the things that I like about orthopedics is, we get to embrace technology, and technology obviously is every facet of life. It's improving our lives. So you got to embrace it. You have to utilize it, and we want to do things that are cutting edge. We want to bring this technology.
Says the surgeon. Ha! Sorry, I'm sorry. I couldn't help it.
I laid it out there. But definitely, this is something that people don't want to. They want the latest and greatest, the cutting edge. They want the newest and best stuff out there, and people aren't going to settle for things. The way media is today, everyone knows about everything at such an early stage. So you can't practice 20-year-old medicine. You have to practice cutting edge medicine. That's what people want and they expect.
Yeah, and as the technology gets better, and whether it be how you perform the surgery or the you do joint replacements, so the actual pieces that you put in, as that technology gets better as well. Yeah, we're talking easier surgeries. We're talking quicker recovery times. Quicker, not only just from the surgery itself, but also rehab times as well. All that speeds up as the technology gets better, correct?
Oh, definitely. Everything from, we're changing every single thing we're rethinking everything that we do and why we're doing it. Everything from pain control medications afterwards to, the procedure itself, trying to do things through as small incision as possible. The rehab protocols, we're trying to get people up and around much quicker. Like the partial knee replacements, majority of my patients are going home the next day.
Oh, wow.
Yeah, so, I have to tell you, even the total knee replacements, I started doing some custom total knee replacements where they're using 3D technology to print the total knees. We're getting a CAT scan of the patient, and they're doing 3D printing in order to print a total knee on them.
That's incredible.
And 75% of my patients have been going home the next day after that procedure. And that's a total knee replacement. That's not even a partial knee replacement.
That's insane.
So it's amazing, the robotic arm that we're using where...
yeah, talk to me about this. How does this thing work?
Basically, we get a CAT scan.
Okay.
The CAT scan... images come onto the computer. We're able to overlay the implants onto the computer. In the OR, we're putting these tracker devices on the femur and the tibia bones. And then, so whenever we move the leg, the computer can see that we are moving the leg. So the computer knows exactly where in space the patient's knee is. And then we're able to do range of motion, the knee, stress the ligaments. The computer now knows how tight or loose the ligaments are, so you can have a nice, really balanced knee. So nobody wants a floppy knee or an unstable knee. They want a stable knee. So we're able to assess the bones, and we're also able to assess the ligaments. And then we're able to put the implants exactly where we want, and we're able to do that with the smallest amount of dissection and involve the muscles and tendons as little as possible.
Yeah, you don't have to be as invasive as you would before.
Exactly.
And one of the cool, and it takes a lot of the guesswork out, because I would imagine, and this is, I'm just assuming here, but back in the day it was, okay, you cut it open, okay, we have to put, it's almost like a jigsaw puzzle. We got to put this here and this here, and it's kind of almost like, kind of doing it by sight. It looks just about right. And again, as technology's gotten better, and with the computers and whatnot, you really, there's no guesswork involved. It's right there. It's right in the right spot. Everything's the way it should be.
Yeah, we get within a millimeter, which is very precise.
That's pretty close. Yeah.
So, before, we didn't. One of the things we made the incision so much bigger for was to protect important vital structures. We don't want to cut through arteries and nerves and things like that.
Right.
So you need to have the exposure so that we can get these big retractors in behind, make sure that we don't cut anything that we want to. But with, the precision, we don't necessarily have to strip as much of the soft tissues around the bone in order to protect that, because we have that level of precision that we might not have had before.
I'm losing myself in this conversation, because I'm so like I want to see it. You know what I'm saying? I want to. It's one of those, like, I understand what you're saying, and I'm getting it, and I'll just be like, wow. Like I want to see, like, I just want to see it, like, in action. And maybe that's just me being like guffawing right now. I'm just like, wow, that sounds awesome.
Well, if you ever get a knee replacement, you know who to go to.
Well, here's the thing. I know people who have had partial knee replacements. I know people, young and old, that have had hip replacements. So I know, how painful it is for them going into it, and obviously, they want the quickest rehab time coming out of it, and trying to get back into the swing of things coming out of it. And that's why Slocum is awesome with this, because cutting edge technology. They're going after the new technology. Just a piece of soundproofing. It's fine. But as far as as far as getting the newest and latest technology is just better for everybody. It's better for the patient. It's better for you, the doctor, the surgeon, and it's also better for Slocum itself because you want to be the ones that just keep going and getting the new stuff and keep just getting better and better at your craft.
Definitely, and this is only the beginning. Hip replacement robotic surgery is right around the corner. I'd say probably within the next couple of months. Hopefully, we'll have that on board.
Oh, no kidding! That's great.
So, it's one leap in advance just leads on to the next one.
And here's the thing: people have this misconceived notion that when it comes to certain types of surgery, certain types of things, you have to go out of the area. And Slocum, and especially something like this that we're talking about today, absolutely proves that wrong.
Oh, definitely. There's no reason. I mean, I came from Johns Hopkins. That's where I did my training. There's a lot of great doctors in this area. They went to great fellowships. They did some great training. I mean, I don't think there's any reason except for maybe some few isolated things that you may need to go, like, Memorial Sloan Kettering Center or something like that for some rare type of thing. I mean, there's no reason to leave the area.
Absolutely, because, we are still here because of personal reasons, same thing with doctors and surgeons and specialists. They're here for the same reasons. Yeah, so it's not to say that, trust me, there's definitely quality all over Central New York. Dr. John Sullivan, orthopedic joint surgeon from Slocum Dickson Medical Group. This is the Slocum Dickson Medical Moment. Of course, Slocum is located on Burstone Road, 798-1500. Like them on Facebook, and of course, you can hit sdmg.com. Slocum Dickson Medical Group, sdmg.com. And doctor, thank you so much for coming in. And one thing I have to say about Slocum, there's so much more than you think they have, and I think that's the best way to say it, because certain people think that once you go in, that's it, and here's number one: if your primary is not there, you can still see specialists at Slocum. You can still get lab work done at Slocum. You can still get all the X-rays and tests and all that stuff. There's specialists, there's therapy at Slocum. So you don't necessarily have to do Slocum for everything, but Slocum has just about everything that you're going to need outside, if you're seeing someone else for a family practice. And that's the one thing I want to get across here is that if you it's almost like you think, if you're thinking about it, more than likely Slocum's going to have it. And I think that's the best way to put it. So, doctor, thank you so much.
Thank you for having us.
And is it bad? I want to ask him to just kind of look over his shoulder one day. I just want to be like his shadow. Is that bad?
I mean,
I promise not to touch nothing.
You can. You can.
No. Maybe I'll wash my hands. I'll wash my hands. I'll
make sure you take a full body shower before you go in there.
It's the Slocum Dickson Medical Moment. It's Big Papa and Banna on a Random Fact Wednesday here on KISS FM.